Have you ever experienced an odd, inexplicable feeling in your body and questioned whether it might be something significant? It's important to pay attention to specific warning signs, as they may indicate that your body is in urgent need of attention. When physicians observe these signs, they recognize that a potentially life-threatening situation may be imminent. In this video, we will discuss 6 warning signs that medical professionals indicate might suggest that the end is approaching. At first glance, these symptoms might appear insignificant, but if you notice them, they could be indicating something crucial regarding your health. From unexpected exhaustion that lingers to a piercing pain in your chest, these signs are your body's plea for assistance. Stick around until the very end, as this information has the potential to be life-saving. Recognizing these warning signs and responding promptly allows you to manage your health proactively before it becomes critical. Let's dive in. First, there is extreme fatigue that cannot be explained. There's a significant distinction between feeling weary after a lengthy day and encountering a type of fatigue that appears to lack any clear reason. If you find yourself feeling utterly exhausted, despite a full night's rest, or if routine tasks suddenly seem unmanageable, it may be your body signaling that something is significantly amiss. This type of fatigue isn't something you can simply remedy, whether it's a cup of coffee or a brief nap. It persists, it burdens you, and above all, it arrives without any obvious explanation. Perhaps you once enjoyed daily walks, but now find yourself exhausted after only a short distance. Sometimes, everyday tasks such as cooking, getting dressed, or even engaging in a conversation can seem overwhelming. This isn't merely a sign of aging. It may indicate that your organs are under stress, that your heart isn't functioning optimally, or that your body is prioritizing energy conservation by shutting down vital functions. Healthcare professionals encounter this frequently, particularly in individuals with heart conditions, renal failure, or advanced cancer. When your body is expending all its energy just to continue, exhaustion can feel all-consuming. This is unusual, and it shouldn't be overlooked. A significant indicator is when this fatigue emerges unexpectedly or intensifies gradually over time. If you once had vibrant energy but now feel weak and depleted for no clear reason, it's time to take action. Your body isn't merely fatigued. It's signaling that something more profound is occurring. What action should you take? Notice when this fatigue began, what exacerbates it, and if it's preventing you from engaging in activities you previously enjoyed. If things are deteriorating and affecting your everyday activities, it's essential to consult a doctor. Taking action sooner increases your likelihood of discovering any issues and addressing them before they escalate. Secondly, intense and abrupt chest pain or pressure. One sensation you must always pay attention to is a crushing, squeezing, or intense pressure in your chest. If this occurs unexpectedly, particularly if it radiates to your arm, neck, jaw, or back, you might be moments away from a serious situation. Medical professionals caution that experiencing chest pain of this nature frequently indicates a potential heart attack or a serious aortic dissection. A lot of individuals tend to dismiss it, believing it's merely heartburn or a muscle strain. When a doctor learns of this type of pain, they act decisively, as delaying treatment can be the crucial factor between survival and disaster. The most perilous type of chest pain resembles a heavy burden resting upon you, causing difficulty in breathing. It could begin gradually and intensify as time goes on, or it might strike you unexpectedly, like a sharp blow to the chest. Your body is clearly in distress, seeking assistance. Here's what you should be aware of. Heart attacks aren't always as dramatic as the portrayals you find in films. At times, the symptoms can be subtle, presenting as a slight discomfort in the chest or upper body, along with feelings of nausea, dizziness, or sweating. That's the reason numerous individuals overlook it until it's past the point of no return. If you experience sharp, tearing pain or a sensation of something ripping inside your chest, it may indicate that your aorta, the largest artery in the body, is tearing apart. This represents a highly critical medical emergency that necessitates urgent surgical intervention to avert life-threatening internal bleeding. What steps should you take? If you experience intense chest pain unexpectedly, seek help immediately. Don't just lie down and wait for it to go away. Don't fool yourself into thinking it's merely stress. Contact emergency services right away. Receiving medical attention promptly significantly increases your chances of survival. If you're still tuned into this video and appreciating these insights, drop a comment with the number 2 below to let me know you're present. If you haven't subscribed yet, I suggest you go ahead and subscribe, and don't forget to turn on the bell so you won't miss any videos. Your support enables us to keep producing valuable content that informs and inspires you. Let's proceed onward. Thirdly, experiencing difficulty in breathing or shortness of breath. Picture this: you're comfortably seated, not engaged in any heavy activity, yet out of nowhere, you find yourself struggling to breathe. The air feels as though it has abruptly grown lighter. No matter how deeply you breathe in, it will never be sufficient. This isn't merely discomfort. It's a significant warning sign. Medical professionals caution that sudden shortness of breath can frequently indicate that a serious issue is occurring within the body. This may indicate severe heart failure, a perilous blood clot in the lungs, or potentially an unnoticed heart attack. It's a common belief that difficulty breathing is merely a part of aging. But when it appears suddenly or progressively worsens, it's an issue that demands your attention. A pulmonary embolism, which is a blood clot that moves to your lungs, is one of the most dangerous reasons for sudden breathlessness. This may occur unexpectedly, particularly after prolonged sitting or following recent surgery. The unsettling aspect is that it frequently begins with a minor discomfort, perhaps a sensation of tightness in your chest, and then out of nowhere, it feels as if you're gasping for air. Another potential issue is congestive heart failure, which occurs when fluid accumulates in your lungs due to improper heart function. It becomes more difficult to breathe, particularly when in a lying position. There are individuals who find themselves waking up in the night, struggling to catch their breath. Additionally, there's the often ignored warning: a silent heart attack. In contrast to the typical crushing chest pain, this kind of heart attack presents with severe shortness of breath, nausea, cold sweats, and an intense feeling of fatigue. A lot of individuals are unaware that they are experiencing a heart attack until it is too late. What action should you take? If you experience sudden shortness of breath without an obvious cause, take action immediately. Take a seat, remain composed, and get medical help right away. Whether it's a clot, a heart problem, or a severe lung issue, quick action can be life-saving. Now, let's discuss another quiet yet alarming warning sign: significant unexplained weight loss. Fourth, significant and unaccounted for weight loss. Shedding pounds effortlessly may seem appealing at first, but it's important to recognize that it could indicate a significant health issue. If you're losing weight without altering your diet or exercise habits, your body might be battling something more serious than you think. Medical professionals caution that unexpected and swift weight loss, particularly in seniors, may indicate serious underlying health issues. Cancer is one of the major offenders. Some cancers, particularly those affecting the pancreas, lungs, or digestive system, may lead to unexpected weight loss prior to the onset of other symptoms. Cancer alters how your body manages energy, rapidly consuming calories at a concerning pace. Yet it's not solely due to cancer. Significant weight loss may indicate serious metabolic issues, undiagnosed diabetes, or potentially heart failure. When your body fails to absorb nutrients effectively, muscle and fat start to diminish, resulting in a sense of weakness, heightened fatigue, and growing frailty. If your clothes are fitting more loosely, you find yourself tightening your belt more frequently, or others are commenting on how much thinner you appear. Even if you haven't made an effort to shed pounds, it's important to start taking notice. Another reason this occurs is one that many overlook: chronic inflammation and infections. Your immune system operates tirelessly when your body is battling an illness, depleting energy reserves and causing weight loss without your awareness. Conditions such as tuberculosis, chronic infections, or autoimmune diseases can deplete your body's resources, resulting in unexpected weight loss that appears to have no explanation. What steps should you take? A sudden loss of over 5% of your body weight in a brief time frame, especially if it wasn't intentional, should raise concerns. Don't think it's merely a consequence of aging. Arrange for a medical checkup, complete your blood tests, and demand clear answers. Identifying the cause quickly increases your chances of preventing something serious before it becomes too late. If you're still engaged with this video and appreciating these insights, please drop a comment with the number 4 below to show me you're present. If you haven't subscribed yet, I suggest you go ahead and subscribe, and make sure to turn on the bell so you won't miss any videos. Your support enables us to keep producing valuable content that informs and inspires you. Let's proceed from here. Fifth, there may be confusion, disorientation, or abrupt shifts in personality. It's disconcerting to sense that your own thoughts are fading away. If you or a loved one begins to forget things unexpectedly, becomes easily confused, or shows uncharacteristic behavior without clear reasons, it may indicate that something significant is occurring within the brain. Medical professionals caution that sudden mental deterioration, particularly when it appears unexpectedly, may indicate a stroke, brain infection, or potentially a serious neurological condition. A stroke can lead to abrupt confusion, slurred speech, or difficulty in recognizing familiar faces in various settings. Some individuals go through a short period where they feel unwell, and then after a few minutes or hours, they return to normal. This may be a transient ischemic attack or mini-stroke, frequently serving as the initial alert before a significant stroke occurs. Severe infections, such as sepsis or a urinary tract infection, can lead to sudden disorientation, particularly in older adults. If a person suddenly appears distant, restless, or has difficulty engaging in a regular conversation, it may not solely be a result of aging. Infections can quickly disseminate throughout the body, impacting the brain and leading to delirium, a condition of confusion that may emerge suddenly. Additionally, we must consider the potential for Alzheimer's or various types of dementia. Although these conditions usually progress gradually, some individuals may face a sudden downturn, becoming disoriented, forgetting recent occurrences, or having difficulty with fundamental tasks that were once effortless. A common error individuals often commit is believing that unexpected confusion is a typical part of getting older. It isn't. When the brain begins to malfunction rapidly, it is frequently due to an underlying medical issue, one that could be fatal if not addressed. What steps should you take? Should you observe abrupt alterations in memory, behavior, or consciousness? It is crucial to obtain medical assistance without delay, regardless of whether it's a stroke, an infection, or another issue. These symptoms should not be overlooked. Taking swift action can truly impact the outcome, as every moment is crucial for brain health. Now we need to discuss the last and frequently most distressing warning sign: intense and ongoing abdominal pain. Sixth, intense and ongoing abdominal discomfort. A stomachache may appear trivial, but when the discomfort is intense, piercing, or persistent, it could indicate something much more serious than mere indigestion. Medical professionals caution that intense abdominal pain, particularly if it appears suddenly or persists for an extended period, may indicate that something within your body is deteriorating. A ruptured abdominal aortic aneurysm is one of the most critical concerns. A weakened part of the aorta, which is the main artery in the body, can rupture, leading to internal bleeding that may become life-threatening in just minutes. The discomfort is frequently characterized as a profound, persistent feeling in the abdomen, lower back or flanks, occasionally throbbing with each heartbeat. If this occurs, prompt emergency treatment is the sole option that can preserve your life. A serious cause of intense abdominal pain is intestinal blockage or ischemia, which occurs when blood flow to the intestines is abruptly interrupted. This may occur because of a twisted bowel, a serious clot, or even late-stage cancer. If your stomach is feeling bloated, firm, or sensitive when touched, particularly if you haven't had regular bowel movements recently, it's a warning sign. Pancreatitis is an inflammation of the pancreas that can lead to severe pain in the upper abdomen, which may sometimes extend to the back. It can strike unexpectedly and intensify after meals, turning even the simplest dishes into a challenge. If overlooked, this condition can rapidly worsen, resulting in severe complications such as organ failure. Certain individuals may also encounter gallbladder attacks, resulting in intense, stabbing pain beneath the ribs, frequently provoked by fatty foods. Many confuse this with acid reflux or gas. However, if the gallbladder becomes inflamed or obstructed by stones, it may lead to severe infections that can be life-threatening. What steps should you take? If you experience any unexplained, ongoing, or severe abdominal pain, seek help immediately. Seek medical help right away, particularly if you experience fever, vomiting, or sudden weakness. Certain conditions necessitate surgical intervention, and postponing treatment could significantly impact the difference between healing and a far more serious result. If you're still tuned into this video and appreciating these insights, drop a comment with the number 6 below to show me you're present. If you haven't subscribed yet, I suggest you go ahead and subscribe, and make sure to turn on the bell so you won't miss any videos. Your support enables us to keep producing valuable content that informs and inspires you. Let's proceed now. Concluding reflections. If you've reached this point, you now realize that your body signals you well in advance of any impending issues. Understanding what to search for and responding quickly when something seems off is crucial. Overlooking these symptoms or thinking they'll simply disappear can lead to dire consequences. We have discussed 6 significant signs that may suggest your body is in serious distress. Sudden chest pain, unexplained weight loss, shortness of breath, confusion, or severe abdominal pain are symptoms that should not be ignored. When something seems amiss, pay attention to your body. It's always wise to get medical help and find out it's nothing, rather than delay and risk it being too late. As we age, one of the most significant hurdles we face is acknowledging that our health can shift unexpectedly. However, the positive aspect is that staying informed empowers you. Being aware of these warning signs gives you the ability to safeguard yourself and to act decisively when it counts the most. There's no need to live in fear, but it's important to remain vigilant. I'm eager to hear your thoughts. Have you or anyone you know ever encountered any of these warning signs? How did you handle that situation? By sharing your experience in the comments below, you might help someone else identify a symptom before it becomes critical. We appreciate your presence with us today. We would be delighted to receive your feedback. Share your thoughts in the comments. What's one thing you discovered today, and how do you intend to apply it in your life? We value your opinions, so please feel free to express them. Your feedback truly inspires and uplifts us. If you found this video enjoyable and useful, kindly give it a thumbs up, subscribe, and share it with others. Your support enables us to keep producing valuable content that informs and inspires you. We appreciate your viewership and can't wait to have you join us for the next video.